Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Today I'm joined with Angie Franks, the CEO at About Healthcare. Angie, how are you today?
Great. Thanks for having me on.
Absolutely. I'm excited to chat. We're going to see whose accent comes out in this, my Boston accent or your Minnesota accent. We will find out. We'll see who wins or loses. I guess there is no winner or loser here. It's just entertaining for the audience that's listening.
Sure.
Well, I'm excited to kick things off. How this usually works, really short and sweet episodes, informative, but short and sweet. If you could start off by telling the audience a little bit about your background, and then we'll kind of go into the why, how, what of about healthcare and some of the topics you and I wanted to discuss here today.
Sure. Yeah, no, happy to tell you. I actually stumbled in healthcare a little over 30 years ago and never really found my way out. I should have been an elementary school teacher, but fell in love with the mission of solving really complex problems in our healthcare system and doing that via technology for the most part. And I've really spent my entire career doing this. I had two short years working in sports technology. And other than that, it's all been healthcare.
That's an interesting kind of going from that to this.
It was.
Yeah, if you want to give me like another, I guess, 30 seconds on that, because that's intriguing to me. I like when people come from, it's not that that's like the craziest space I've heard someone go from, into healthcare, but I'm curious.
Yeah. My story there was, and this was just a few years ago, actually, was really probably more about me and my desire to challenge myself to see if I could go work in another industry and figure it out and do what I love to do, which is focus on growth strategies and how to really grow high-tech companies. And there was a company here in the Twin Cities that was called Sport Engine. They were founded by a few guys in their college dorm room, and they just had such a fantastic market opportunity. And I joined them for a couple of years while we worked on building out the product strategy and our market, kind of our business plan, multi-year growth strategy. And we ended up selling the business to NBC Sports and Comcast, which was just a blast and really fun to get into an industry like sports and into the media industry and see how much it actually has applicability and relative opportunity in healthcare. So I think those years that I spent there were really fun and challenging in a different way, but also relevant to things that I'm doing today.
Yeah, it's not the craziest space I've heard. Actually, there's probably a closer correlation there than some of the other spaces people go, from that into healthcare. Sure. But thank you. It's always great to hear your personal story. Something we always focus on the podcast, especially with first-time guests, is the why, how, what of the company. If you could share that with us, that gives the audience a really good sense of really why you're doing what you're doing, how you're doing it today, and then what exactly you do. Because sometimes, while a lot of your followers will listen to the podcast, you're going to get some new listeners and some new eyes and ears, right? So appreciate that. And then you and I today, our core topic at hand, just so everyone knows, is patient access and orchestration of care. But that really stems based on what you're doing today. So let's
for sure. Well, maybe I'll start with the what we do, and then I'll back into why we do that and how we actually make that all happen. What we do is we help health systems put in place an infrastructure to ensure that they get more patients coming into their system. And once they're there, they keep those patients inside of their system of care by ensuring that patients are in the optimal setting for whatever their healthcare needs are at the time. And so we call that access and orchestration, and helping health systems do that by leveraging all of their sites of care and all of their facilities for making sure that patients are in the optimal setting, and optimal being defined as the lowest cost setting with the best clinical outcome. So how did we really get here? And if that's our what, why do we do this and how do we get here? The how we got here is we really started out 15 years or so ago by solving the problem of acute interfacility patient transfers. So this is kind of one of these things where even after 25 years in healthcare, when I joined this company, I had no idea that this business process existed. But basically, this is when you've got patients that are in a care setting, maybe they're in a rural hospital, maybe they're in a community, they came into an emergency department at a community hospital, and that particular setting of care could not take that patient for whatever reason. They didn't have the capacity, they didn't offer the right services, the patient's acuity level exceeded that hospital's ability to care for that patient, and they needed to make the decision to transfer the patient to a different care setting, a different level of acuity. We were founded to solve that problem, and we were founded by a physician who's a hospitalist, works today still as our chief medical officer, and he was working in the greater Salt Lake City area in a community hospital as a hospitalist, and he was experiencing the pain of having patients in front of him that needed to be somewhere else for their care, and the manual phone calls, waiting to get calls back, waiting for somebody to say they could take the patient, say yes to that transfer, and then all of the logistics on facilitating that move from taking that patient from point A to point B was just a very manual, time-consuming, labor-intensive process for the nurse and the physicians. And so he looked at that, facing that challenge for many years in his career, and was like, there's got to be a better way to do this, and founded the company, which was at the time called Central Logic. We rebranded to About just a couple months ago, but he founded the company to solve that problem. So we started with interfacility acute transfers. Today, when we say patient access and orchestration, we have basically taken the problem of how do you make decisions about where a patient should be for the care that they need. How do you help that provider or that nurse or that case manager help make that decision for that patient? We built all of those capabilities onto what we call our orchestration engine, and we come in and we put this infrastructure in place inside of health systems, and we help make those decisions for moving patients into the acute setting and out of the acute setting to the appropriate post-acute skilled nursing or even home in today's world, where many acute patients are being treated at home. And so we have the end-to-end logistics for making that decision, executing against that, and physically moving the patient to the appropriate setting of care. And we call that access and orchestration. And that's where we are today. What we do and why. Here's why we do it. I forgot the why part. The why we do it is we're talking about a patient life here. When you're looking at a patient transfer, this is somebody that's probably having the worst day of their life. They're having they're having a significant medical event, and they need to get to care quickly. When that process is taking 3, 4, 5, or 6 hours to facilitate a decision to move the patient is suffering, and their clinical outcome is being compromised while they wait. Same thing on the back end. When you're moving the patient out of the acute setting to the next best setting of care, that experience for that patient and getting them to the level of care that they need, so that somebody that needs that inpatient bed more acutely can also get access to it, is also critical, not only for the patient being moved out, but for the patient that would occupy that bed next. So really, this is important clinically for patient outcomes. It's important operationally to remove friction and noise in the healthcare system for clinicians and nurses. And it is important financially for health systems to ensure that they can take that demand for services, align it with the supply of resources, and ensure that they're utilizing all of their resources for the appropriate patients and level of care. It becomes a revenue engine for the health system.
Absolutely. Yeah, it's interesting to hear about your obviously the rebrand, and why everything came to be. I think, you know, one of the things that I think is really interesting is, you know, you mentioned, you know, the patient access and orchestration. And one of the things that I think is really interesting is, you know, you mentioned, you know, the patient access and orchestration. And one of the things that I think is really interesting is, you know, you mentioned, you know, the patient access and orchestration. And one of the things that I think is really interesting is, you know, you mentioned, you know, the patient access and orchestration. And one of the things that I think is really interesting is, you know, you mentioned, you know, the patient access and orchestration. And one of the things that I think is really interesting is, you know, you mentioned, you know, the patient access and orchestration. And one of the things that I think is really interesting is, you know, you mentioned, you know, the patient access and orchestration. And one of the things that I think is really interesting is, you know, you mentioned, you know, the patient access and orchestration. And one of the things that I think is really interesting is, you know, you mentioned, you know, the patient access and orchestration. And one of the things that I think is really interesting is, you know, you mentioned, you know, the patient acc it's I always it's not I definitely like the new name
Sure.
better. It's nothing against the old name, but yeah, very very interesting. And what you and I want to talk more about is, we mentioned it a little while ago, and you talked a little bit about this in your why, how, and what, but patient access and orchestration of care. But then more importantly, we want to be able to lead that into why are those things so important today? I mean, they were always important, but why are they even more important today? And one of the things that you and I were talking about is really because of the workforce shortages. So if we could talk more about kind of those core things and kind of put them together, be much appreciated.
Yeah, absolutely. Well, when I talk about this whole process of patient access and orchestration, I mean, when you think about how we've typically operated in the healthcare system, it's been a little bit of, we've built it and patients come. So we've got our facilities, we have our offices, patients show up. And that is all true, and that will always be true. But as we're moving to, how do we really care for that whole patient and make sure that patient is in the best setting of care for the outcome that they need, or for the level of service and care that they need. Being able to support physicians and nurses and case managers in that decision-making process is really, really critical and really an important piece of what we do today, and why it matters in this world of workforce shortages and burnout. Much of what we automate are really pulling together data and disparate systems and putting that into one automated business process where we can take manual work out of the hands of nurses and case managers and physicians, and we can automate that and give them the right information that they need in order to make a good decision. And what happens is they're making phone calls all over the health system. They're making phone calls to post-acute facilities, and they're waiting for call back. And they don't have the time to do that. And that is really an unnecessary piece of work that could be automated and centralized and standardized for more efficiency and a better experience for those clinicians and better outcomes for the patients. So in this world with workforce shortages, that's really important. If we look at on the transfer side and on the acute demand side, in this world where today, our new normal is, waves of the pandemic will continue to happen. And, we're just now hearing about this new variant after the Delta variant. And what happens is demand is, vacillating wildly for these health systems. And, if we go back to the original onset of COVID, we're also familiar with what happened in New York City. But what happened in New York wasn't that we didn't have capacity to take care of the patients. We just didn't have the patients in the places where we had capacity. And we didn't have that because we weren't able to bring the data together to proactively intervene and make decisions. So when the USS Comfort comes pulling into port and you've got 1,000 beds on a ship that ended up treating 115 people, it wasn't because we didn't have room to treat more people. We just had people in one setting and no ability to facilitate that transfer and get them over to a better setting of care. And so that's really, I think, another new normal that our healthcare system and all of our health systems are really normalizing to right now, is we're just going to be living through variants and pandemics and surges in demand, and utilizing technology to make decisions, load balancing, and getting patients to the optimal setting will be more important than ever moving forward.
Yeah, it's we'll see what ends up happening with the new variant. That's why you and I were talking about the flight prices and everything, right? Like that's why I know I can get what's it called, a better deal if I do non-refundable. Right. But do I do that with everything going on, right? Because I think that's part of the game right now too. Is let's sell as many of these tickets, because who knows if we're going to be shut down for a little while again.
That's right.
I think we're in a better position now if there's any thing like that, just because more digital and more of our workforce is in a remote setting, but still. I mean, it's been pretty crazy, like just not being able to see really almost 2 years now, right? Like we're not back to our normal state.
Right.
And you wonder, like, if it goes beyond 2 years, like, will we ever get back to that position?
Yeah.
again?
And you know what I think this is the new normal. And while COVID may wane, and maybe it's another year or 2 years, or we move through this particular pandemic and the various, new variants of the disease. The reality is we'll face more of this as we move forward. And we are certainly in a very different place than we were a year and a half ago, where it was just pure unknown. How are we going to get through this? Now today we've largely distributed our workforces. We've largely learned to operate, in that type of a distributed work environment. We're seeing the effect of the strain for our healthcare workers who have had to operate under conditions that we've never seen before. And I think that is a new real crisis that we're going to have to deal with as a healthcare system. I think we're going to see behavioral health needs, as we've talked about in the industry for a while now, are really spiking. It's another use case for us for access and orchestration, is making sure that we are able to facilitate moving patients to the appropriate behavioral health facility or access to the appropriate resources where necessary. That is going to be another surge in demand as we continue to, see all these stressors with health and our ability to earn incomes, and that being disrupted, our cost structures increasing so significantly. It is a different day. I think we're in a different place, but I do think it's the new normal that we have to now adapt to, just operating this way moving forward. And I do see health system leaders, I think they definitely have acknowledged that, and now are trying to figure out, okay, what's the best way to move forward? And that's what we're really helping many health systems do, is figure that out.
We shall see what happens. But Angie, thanks again so much for being a guest on the podcast. Hopefully we can have you on again soon and talk about some other issues. Like I said, we keep these short and sweet, and it was an absolute pleasure speaking with you today, and wish you all
Thank
all
you
the
so
best.
much, Jared. Had a great time.